Thank you, and I believe, Mr. Chairman, that this is the first time we gather after you made your announcement, so I think it is absolutely appropriate to congratulate you on your decision regarding your retirement and to show you our full respect and full appreciation for the amount of service you have given to our nation, not just as a policymaker here in Congress, but also in your service in our military and as a physician. And so as a fellow physician, it's going to be sad to see you leave, but know you're loved and know that you're very well respected, and our nation appreciates you 100%.
And I will miss working with you. And I think we got a few bills we can get past this year.
We must. We must. It's been a while, my friend. And thank you to Ambassador Nikangusang, Assistant Secretary Pace, and Assistant Administrator Gawande for your participation today. I must say, Mr. Chairman, right now you probably can't see or really feel, but inside I'm like a kid at a candy store. I'm really excited to have all three of you here. All three of you have done remarkable work, have led your profession, and have been thought leaders for our nation and many countries around the globe. So I want to thank you personally. And I also want to give a special thank you to Dr. Atul Gawande, you see, because when I was a third-year medical student doing my general surgery rotation at the Brigham and Women's Hospital, I actually scrubbed in with Dr. Gawande when he was a fellow there. And I really need to thank you for your kindness, because despite you looking like you hadn't slept in 7 days, you were still kind and patient in helping me maneuver around the operating room. So thank you so much. In the last 3 years, the world has preserved through a deadly pandemic that has claimed nearly 7 million lives across the globe. Now, as we reflect on the international response to this public health crisis and look to the future, we must do so with a commitment to advancing global health security. There is no international organization as central to this work as the World Health Organization, which has contributed to monumental advancements in healthcare access, improvements in population health outcomes, and the defeat of deadly diseases, even in the farthest corners of the world. The WHO's continued surveillance of global health threats has helped prevent outbreaks of deadly diseases, such as measles, from arriving on our shores. And the WHO's global vaccination programs have helped contribute to an overall 54% increase in global life expectancy in the last 70 years and put us on track to prevent 51 million deaths from measles and hepatitis B around the world. So, I want to take the time to emphasize now that our work to prevent and prepare for future pandemics is not in conflict with enhancing international cooperation. Instead, our efforts are strengthened and fortified by it. In our last hearing on biosafety and biosecurity, we all agreed that threats to the American people's health do not end at our borders. So in order for us to ensure our nation is truly prepared for the next pandemic, we must continue to engage with the international community on work that prevents future threats from reaching our nation. The United States has served as the preeminent leader in global health for decades, and now is not the time to cede that role to another country angling for global influence. No, now is the time to reinforce the United States global health leadership with meaningful reforms to the WHO that promote transparency and strengthen international cooperation in the event of future pandemics. Thankfully, after years of volatile leadership under the previous Trump administration, the Biden administration has sought to correct course by re-engaging not only with the World Health Organization, but our partners around the world to advance global health and our interest abroad. You see, when we become an isolationist nation, we leave a void that other countries can come in and easily fill to use public health diplomacy as a way of geopolitical dominance. Taking a lessons-learned approach from the early days of the pandemic, the Biden administration has pursued reforms to the WHO, and I think we can all get behind. Reforms that, one, enhance oversight of member states' compliance with international health regulations, two, develop an early warning system for public health threats, and three, strengthen investigative capabilities for public health emergencies of international concern, exactly what we're working on to strengthen. So these reforms would not only institute positive change at the World Health Organization, but they would also enhance pandemic preparedness on a global scale, and therefore reinforce U.S. influence in international institutions and norms. You see, in many ways, global health is the cornerstone of our diplomatic efforts, and we must continue to find ways that enhance our role in this space on the international stage. The fact of the matter is, when we leave gaps, our adversaries will fill them. So now more than ever, we should work to deepen cooperation with our allies and commit to a collaborative approach to global health security that will ultimately counter the Chinese Communist Party and deter their influence. Bold investments in global health and pandemic prevention made through the Consolidated Appropriations Act and the American Rescue Plan have set the stage for this work. For example, the American Rescue Plan funds bolstering the WHO's COVID-19 vaccination administration efforts helped vaccinate approximately half the world's population for COVID-19 within 1 year period, with the U.S. vaccines making their way to key regions of the world where we compete with the PRC for influence. Additionally, the Biden administration has complemented these investments with forward-looking policies that advance U.S. interests abroad. Notably, under President Biden's leadership, the State Department established its Bureau of Global Health Security and Diplomacy, with Ambassador-at-Large Nick Ngangsong at the helm. Ambassador Nick Ngangsong, I look forward to hearing from you today about how the Bureau has integrated global health security in our national security and foreign policy priorities, and how the United States is engaging with WHO to advance that effort. So there's certainly a great deal of ground to cover in today's discussion, and it is my hope that today we can identify constructive reforms to the WHO that build on the administration's effort to enhance global pandemic preparedness, as well as forward-looking policies that further cement America's leadership in global health security. So with that, thank you, Mr. Chairman, and I yield back.